it comes to that final stage where you're pushing and you're actually going to deliver your baby soon, what position do you imagine yourself in? My name is Dr. Nicole. I'm a physical therapist and a mama, and there are 3 positions that are extremely common for moms to deliver their babies in. And I want to give you the pros and cons of each of those 3 positions today. The first position that we see a lot of moms deliver in movies and on TV shows is a dorsal lithotomy position. Basically, this is just when you are laying on your back, your legs are bent, you may even have your feet in stirrups at this point. It's a position that we are used during a lot of our yearly physicals and during pap smears, and it's very common. This is how providers practice delivering babies during medical school. This is how they have delivered lots of babies traditionally, so they are extremely comfortable with this position and will probably default to this position in most scenarios. There's a couple of problems with this position, however, and that is that 1, because you are laying flat on your back, it can mess with your vitals. It can make your blood pressure go down or your baby's oxygen levels go down because all the weight of baby and all the extra fluid is pressing on our cardiovascular system, and so our veins and arteries aren't carrying our blood the same way that they would if we were in a different position. And you may have even noticed this during the last trimesters of your pregnancy. So if those things start happening, you would want to lift your head up if possible by elevating the bed or extra pillows to get into a more semi-reclined position. And this is the second position I want to talk about today. It's basically the same as the dorsal lithotomy position, but your head is elevated a little bit, and this is hopefully going to make sure that your vitals don't get out of whack and it doesn't turn into an emergency situation. The third position to talk about today is a exaggerated dorsal lithotomy position. This is just like described before. You're laying on your back, only this time your legs are pulled up towards your chest. If you have the energy and strength, you might pull them up towards your chest yourself, or if you're just completely exhausted from a long labor or you've had an epidural and you don't have as much control of your legs, you might have like your support person and a nurse or other staff pulling your legs up towards your chest. Sometimes if you are stuck laboring for a long time, you've been pushing for a while, there's no progress, labor is stalling, they might use this exaggerated dorsal lithotomy position to open up your pelvis, change the way that your pelvis opening is, and sometimes it can help get baby through those last stages of the birth canal and be delivered successfully. The problem with this position is that 1, it's usually more uncomfortable for mom compared to other positions that we could use. 2, you have a higher risk of an episiotomy or perineal trauma in this position. And thirdly, it is a higher risk for nerve injuries in this position. And this is especially true if you have had an epidural and you really don't have full sensation, because what happens is you or your support people are holding your legs up and they're held there for a long period of time. You don't notice that it's compressing your nerves because obviously there's a lot going on and pains that are a lot more significant than what might be uncomfortable from your nerves being squished. And so afterwards, you might notice different weaknesses or tingling sensations, and it has to do with that nerve being compressed for a long period of time, especially if you are in that pushing phase for a while. As I said, these positions are very common. Providers really like these positions, and so it's pretty likely that you could end up in one of these positions for delivering your baby. So if you are in one of these positions, here's a few things that you can do to try to make sure you don't end up with complications. The first thing is that if you are laying flat on your back and vitals of you or baby start to get worrisome and your provider is thinking, oh man, we might need to end up with a cesarean or the forceps, or we're gonna have to do something because things are turning into an emergency situation and the safety of you and your baby are at risk, see if elevating the head of your bed and getting into that semi-reclined position or rolling onto your left side, where we know that our cardiovascular system can work a little bit better, suggest one of those positions. Ask your support person in advance to suggest some of those positions in that situation so that you can try to avoid needing those interventions if you were hoping to have a vaginal delivery. The next thing that you can do if you end up in that position where you're laying on your back and your legs are pulled up towards your chest is between pushing and between contractions, ask if they will relax your legs back down to the bed. Because you're not pushing for 45 minutes straight, you're pushing with contractions and then you are resting in between contractions. And that will just take some of that pressure off of your nerves, because if you are in that position pushing for 45 minutes and your legs are pulled up towards you the whole time, that's a long time for a nerve to be compressed and some serious damage could happen. But if you let your legs back down onto the bed between each contraction, this is going to be a great way to prevent nerve injuries. Unfortunately, if you've had an epidural, you just don't have as much sensation of your legs, and so sometimes this is happening and you're really not even noticing, or you're just completely distracted by all the pain and everything going on to try to deliver this baby safely. That's completely understandable, so think in advance to talk to your support person about, hey, if I end up in this position, can you make sure my legs are getting relaxed between each contraction? And then the third thing is that if you end up with an episiotomy or afterwards you're noticing like, I just don't think I'm as strong on this side, or I'm trying to stand up from a kneeling position and this one leg is just really weak, those probably mean that some kind of nerve damage has happened. And so ask your provider as soon as you notice it if you can get a referral to physical therapy. You don't need to wait until your 6-week appointment to get a referral to a physical therapist. Of course, we are not going to be doing any internal work before we get approval from your provider at 6 weeks, but the sooner we can get scar mobility in the case of episiotomy and strengthening going in the case of a nerve injury, the hopefully more complete and quicker the recovery will be. And so that's why it's so important to get that referral as soon as possible. The question of the day I would love to see in the comments is, did you know that you had a choice about what position to deliver in, or did you just assume that they would tell you what to do and most people deliver in the same position? Love to see your thoughts on that. Please subscribe to my channel if you like to see videos about pregnancy and what happens during labor and delivery and how to recover in the postpartum phase. And I'd love to get a thumbs up if you liked this video today so that I know to make more videos just like it. Thanks so much for joining me today, and we'll see you all next time.